therapy. Okay. The process of this therapy is to get the facial and neck and head muscles, which there are some up here, into balance so that they're all working for you instead of against you. If you're using your jaw like this, or any number of ways, especially like this, or clenching where you can see these muscles like this, they really get out of balance. And as we looked at your tooth structure, when you open, that's the first tip-off, my dear, is that your teeth don't fit evenly. So it's no wonder that your right side is more involved because your teeth are at an angle. So if we can get those muscles so that they come into balance, then because of the muscle over bone, what we find is that you just begin to function normally. And it takes some exercising, and I'll give you different things to do each time when you come. I'll take your measurements every single time. We evaluate what the changes are. We look at your photographs, and I can bring them up from my office because these go to my office computer, and I'm connected on a tunnel. And so we can actually look at them together and see what the changes are. So the process is neuromuscular exercise, postural training, and nasal breathing, which really makes a big difference.
And what sort of symptoms does this tend to alleviate?
Should alleviate most of the pain, should stop the clenching. That's the feedback I get anyway. We should see the teeth coming into a better position. Because I've got pictures of that first one, and you have too, so that we ought to be able to see those teeth actually straighten up some when your tongue is not postured in there. It will, I don't know how much it will help your fibromyalgia, but I've seen a lot of patients who've had it and feel like it's minimized when they start getting the lymph system to work better too. And the breathing mechanism, that's such a biggie for muscles, is being able to nasal breathe, warm, filter, humidify the air, get better oxygen. That makes a big difference.
Clear up my shiners.
Hopefully. That'd be fun. Yeah.
You said you had 2 websites. What are they?
They are
Right here. srcoulson.com. Faces by Coulson.
Mm-hmm. And I'll give you, these are my brochures, so you can have one of each. The Institute, where I teach, the practice, and I do facial rejuvenation. It's got something on it. Has to go somewhere. But you can scope through those and get a sense of what else goes on with this. Because, a lot of people, I think, believe that my practice is children. Not at all. It's 60-40. Certainly I see a lot of kids, but I see 40% adults easily. So
I have several people that I have in mind that we have a friend that had got bit by a dog in her face.
Gosh. Yes. Well, cleft palate patients, those sorts of things that certainly. You want to take this, and actually I want to copy this first before I give it to you. And then I do a little copy of this. And your statement, that should be somewhere here.